Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this project of study and learning together. Hypnosis is a powerful technique with which you can help and improve the quality of life of many of your patients. However, it is common that both patients and therapists have false and erroneous beliefs that make it difficult for clinical hypnosis to be used effectively. In this video, we will look at these false beliefs, emphasize the clinical effectiveness of hypnosis and the research currently at the forefront, and discuss the increasingly widespread use of this excellent therapeutical technique. This technique has been used in clinical practice for many years. Remember, in the past centuries, Bray, Charcot, Mesmer, among others. Therefore, it is important and necessary to start with a correct definition. Hypnosis has been defined as a situation or set of procedures in which a person designated as the hypnotherapist suggests to another person designated as the patient to experience various changes in a sensation, for example, pain relief, in a perception, for example, visual hallucination, in a cognition, for example, expectations, or in the control over a motor behavior. In the clinic, the hypnotic context is usually established by an induction procedure. During hypnotic inductions, the hypnotherapist guides patients through soothing and calming imaginary with the goal of helping them feel more relaxed, distracted from aversive stimuli, and more open to therapeutic suggestions. It is important to note that being open to therapeutic suggestions means that patients may be more willing to cooperate with the hypnotic procedure, but not becoming vulnerable in some way. The induction phase is followed by the application phase, in which the hypnotherapist gives suggestions to the client. These suggestions may refer to the patient experiencing changes in sensory or cognitive processes, in physiologically, for example, heart rate, or in behavior. For example, suggestions to decrease stress or pain, and to increase vitality and perceived efficacy are frequently reported in the literature. Relaxation induction should not be considered as the only method of conducting a hypnosis session. There are different types of inductions, and all are recommended and equally successful. For example, a physically active induction, such as pedaling a stationary bicycle, has been proven to be effective. It can provide energy and vitality to patients who are depressed or tired. Patients who are not interested in food can have an appetite or get pain relief to patients after surgery or with persistent pain. Depending on what the patient has seen or read on television, movies, or entertainment programs, they may be afraid or erroneous beliefs about hypnosis. Depending on what the patient has seen or read on television, movies, or entertainment programs, they may be afraid or erroneous beliefs about hypnosis. In the popular media, an erroneous image of hypnosis is given as a resource to control the mind, as a means to recover lost memories, and even as an inducer of criminal or unwanted behaviors. Therefore, from the clinical and ethical perspectives, before the first session with hypnosis, it is crucial to educate the patient about what hypnosis is and what is not. Demythologize this technique, dispel the myth, and talk about those potential fears about hypnosis. This method is like the one used by medical health professionals to present any medical or psychological intervention to patients. In general, we have an image of hypnosis linked to the spectacle, sometimes theatrical, and this has nothing to do with clinical hypnosis. In general, we have an image of hypnosis linked to the spectacles, sometimes theatrical, and this has nothing to do with clinical hypnosis. The purpose and the approach are different. Everything that hypnotism potentiates as a show, such as the lack of control or the loss of the subject's identity, is exactly the opposite of what we as hypnotherapists should do: more self-control and more management over what the person does. It is true that in the shows you hypnotize, yes, of course. I personally have appeared on many television shows. When we watch television, only a part of it comes out. A small part of what is recorded not to the preselection and preparation stage. A part of the population between 7–10% are very suggestible and easy to manipulate. The rest of the people who could be treated with clinical hypnosis would not attend a show. The professionals of the show know how to distinguish these people. Hypnosis and its main myth. As we all know, the biggest obstacle that hypnotherapists encounter when using hypnosis techniques is the large number of false beliefs and fears that surround the practice of hypnosis. Beliefs which have been increased by the hypnotherapists of theatre and media. As professionals, we are not opposed to any type of hypnosis. We believe they are promoting this powerful tool, and to some extent, some of them are beneficial. Unfortunately, not all of them do this work well. Our mission is to educate, or rather re-educate, those who have seen this program or shows. Unfortunately, the treatment that hypnosis has traditionally received has been more linked to the esoteric, magical and paranormal world than from a scientific point of view. All this has engendered a series of false ideas about what hypnosis is, and thus has led to the emergence of false myths about it. The result is very unfavorable for hypnosis, hypnotherapists and patients. For hypnosis, because it degrades it and turns it into a mere spectacle. For hypnotherapists, because it hinders the application of clinical hypnosis. For the patient, because the patient is contaminated by this false myth. He is trapped in a halo of fear and uncertainty, which usually prevents him from succumbing to the professionalism of the hypnotherapist, and therefore makes it difficult to enter the best hypnotic state for a deep treatment. It is necessary to remember that before using hypnosis, it is important, necessary, and fundamental to make these misunderstandings disappear, these mysteries of the patient's mind, this great number of false beliefs related to hypnosis. We must clarify the concepts and eliminate the fear provoked by false beliefs that will make the patient hinder consciously and unconsciously the hypnotic process. The time we dedicate to demystify hypnosis is not a waste of time. On the contrary, it will make it easier for patients to enter the hypnotic process. Among the most important, we can mention the following. Hypnosis is only suitable for the weak-minded or weak-willed. I can get hooked and not wake up. It is diabolical practice. They can reveal my intimacies. Fear of making a fool of myself. I can be abused. You totally lose consciousness. In hypnosis, we are asleep or unconscious. Hypnosis is dangerous. Hypnosis implies a loss of will. The hypnotized person is under the control of the hypnotherapist. The success of the hypnotic trance is due to the power of the hypnotherapist. When you come out of the hypnotic trance, you do not remember anything of the session. Hypnosis is only suitable for the weak-minded or weak-willed. The main blame for the belief of this myth lies in the practice of show hypnosis. Evidently, everyone likes to seem intelligent, so it is better to demystify it, which will help us to induce patients more easily. It is scientifically proven that intelligence is positively related to hypnotic trance. In other words, the stronger the intelligence, the more likely it is to enter a hypnotic state. Patients like to hear these words, and I believe this will be one of the main ways to improve hypnosis. I can get hooked and not wake up. These are people who are afraid. They believe that in a state of hypnosis they go, I don't know where, and they stay there and do not come back. This is related to the hypnosis of regressive type, with the conviction that the patient manages to unfold or astral travel, and the doubt arises in the person of how to return. We must make it clear to the patient that if something were to happen to the hypnotherapist, for example, if during the session she were to die, the patient, after 10 minutes without hearing the voice of the hypnotherapist, would wake up and automatically comes out of the trance. Since while we are exercising hypnosis, we are not asleep, it is difficult to stay in that moment. to remain in a state that is not being enjoyed. Because sleeping is completely different from active, selective, conscious concentration, in hypnosis, communication is received, something that does not happen when we try to talk to someone who is asleep. In fact, what could happen is that when hypnosis is being performed in a relaxed environment, patients fall asleep, because the transition from relaxation, not hypnosis, to sleep can be very easy if the person is tired or drowsy. Given that hypnosis can also be performed with the eyes open and physical exercise, it contradicts the possibility that hypnosis is the author of the mental hang-up. Hypnosis can be used to promote physical exercise. For example, hypnosis is widely used for elite athletes today. It is a diabolical practice. Basically, there is still a belief in the elderly and older people that hypnosis is part of the satanic ritual, and people associated with certain religion still consider hypnosis as a satanic practice. It is important not to say in the first session that you are going to practice a first hypnosis, because if the person has this condition, you will not be able to apply it easily. It is therefore good indirectly to find out what their beliefs and religion are, and not to mention the word hypnosis, without first being sure that there is not collision with their beliefs. We will say in this case we are going to do a few minutes of relaxation. All this supposing, of course, that the patient comes to our clinic to receive a hypnotherapy treatment and accepts that he or she is going to do it. It is a question of doing it without warning. What it is about is to induce him to begin the induction without this alert. A responsible hypnotherapist does not have to alter, touch, nor affect the religious beliefs of his patients to carry out a treatment. The use of clinical hypnosis is currently therapeutic. It has no link with any sect or religion. They can reveal my intimacies. It is believed that a patient in a hypnotic state will be inhibited by his or her faculties. Let us make it clear to the patient that no one can get anything from anyone. When he is in a hypnotic state and does not want to voluntarily answer, he will not do it, and much less if it goes against his ethical or moral codes. Therefore, if the patient does not want to, he or she will not tell his or her intimacies. Fear of making a fool of oneself. Because hypnosis is sometimes abused in certain theatrical and circus performances, some people go to the clinic reluctantly, for fear of being laughed at. Curiously, those who tend to volunteer for a theatrical session are those who would like to be in the center of attention. It is necessary to know how to distinguish and to make clear to the patient the difference between the hypnosis of salon or show and the clinical hypnosis. They can abuse me. This situation will only occur if the patient allows it. The most depraved hypnotherapist would be incapable of getting physically or psychically with a patient, since no one can interfere in the moral or ethical codes of the patient. Sexual abuse of patients by hypnotherapists is impossible because it will interfere with the patient's moral codes, and these codes cannot be broken under hypnosis. No one can be induced suggestions or ideas that goes against their ethical or moral principles. If we order something to a hypnotized person against his convictions, that person will respond with a certain degree of agitation and will come out of the hypnotic state. If we order him to commit suicide or a crime, and he believes that it violates his beliefs and values, then the person will become confused, and this will cause him to awaken from the trance. Consciousness is totally lost. This is the most extended myth, and it is necessary to make understand that to remain hypnotized is not to be asleep. The consciousness always knows what one experiences while being hypnotized. Despite the deep unconscious contact, the mind can comment, criticize, and censure. We always have control over what we say. Hypnosis is not the truth theorem. It is not surprising that after a hypnosis session, the patient comes out with the sensation of not having been hypnotized, because he has listened and has found out everything that has happened. In hypnosis, we are asleep or unconscious. If this is true, the hypnosis cannot be used for anything more than simple rest, don't you think? Hypnosis is not sleep, and the patient always retains some level of alertness, as it is focused on certain sensation or stimuli which the therapist is guiding him. Hypnosis is dangerous. Given that the person who realizes the hypnosis is a professional hypnotherapist and has dominated and understood the technique, the hypnotherapy does not have any danger. The most dangerous thing that can happen during hypnosis is that the patient falls asleep. If this happens, it would not prevent at all to carry out the hypnotic session. There is no risk in being hypnotized by a professional, but used by amateurs. Hypnosis can bring out hidden traumas over which you lose all control. Hypnosis is not a game. It is a very powerful technique, which can help to overcome an illness, both physical and physical, and should be used by professionals related to it. Hypnosis in the wrong hands is the same as a wrongly prescribed medication. Therefore, hypnosis is one of the safest methods and has no side effects, as long as it is performed by qualified experts. Hypnosis implies a loss of will. If there is no desire on the part of the patient to be hypnotized, there will not be hypnosis. Hypnosis cannot be induced without the collaboration of the patient. Hypnosis is a teamwork, formed by the therapist and the patient, where both are willing, one to apply the hypnosis and the other to receive it. If the patient does not want and resist it, there is no hypnosis. The hypnotized person is under the control of the hypnotherapist. This is false, since the hypnotized patients are not dominated at all by the hypnotherapist, since they have completely intact the capacity to make decisions. If a hypnotized patient is commanded to do something against his will or against his personal code of conduct, ethical or moral code, he would immediately come out of the hypnotic state. Hypnotized patients obey what they want and never against their own will. The success of the hypnotic trance is due to the power of the hypnotherapist. Any person, regardless of sex, with deep or high-pitched voice, etc., can hypnotize. Hypnotic trance is induced by inductive techniques. Hypnotic trance is induced by inductive techniques and does not require the use of any kind of physical energy or power, nor does it require any gifts. People of average intelligence can learn inductive techniques. Another thing is the serious and professional practice of hypnosis. That is, it takes study and preparation to work with patients effectively. The success of the trance is due to the willingness of both parties. In other words, the therapist's willingness to induce the trance and the patient's willingness to accept and collaborate to achieve it. When coming out of the hypnotic trance, the patient does not remember anything of the session. Most patients remember everything or almost everything that was said and done during the session. Some patients present a spontaneous amnesia when coming out of the trance. However, to avoid this amnesia before leaving the hypnotic state, the patient is induced to remember everything said in the session. Example: now I'm going to count to 6, and when I say 6, you will open your eyes, and you will feel great. You will feel new and refreshed. Above all, you will feel very relaxed, and you will remember everything said in the session. If you are interested in learning more about the hypnosis in a professional way, watch our next video, Suggestibility and Hypnostability Tests. If you have questions, ask them in the comments area. On this topic and many others we will talk about in the channel and in the videos that we will publish. So if you are interested, do not miss our next videos. Thank you very much for your interest.